So as I said, India is the biggest affected one, so India has an obligation to make discovery. India cannot escape. But drug-resistant tuberculosis is all over the world, so whole world is interested. But if we make it open source, world gets nervous. They get very nervous. So I keep telling, open source for tuberculosis. It is not open source for your cancer. You make money in cancer, tuberculosis. But in the process, once you do tuberculosis, you know very well, you can do other things. How do we control one bug which has evaded us? So therefore, all the drugs, if you look at, are old. Discovery 50 years, 60 years. The genome is completed, 12 years now. So 1998, if we finished the sequencing, so 2008 was the 10th anniversary of the Mycobacterium genome. So my argument was, it's a shame to the genome community. After 10 years of genome, you cannot even get a new drug. Forget about solving the problem of human diseases, asthma, diabetes, and cardiovascular. Correct? So this is the challenge. And the challenge is, let's look at these chemical molecules. How did they become drug? What is common between this? Because you don't know chemistry, but you know biology, okay? Let us say this is a drug. The shape of this, the chemical molecule is a drug. Now you are all biologists. Can you tell me where is this can go and bind in biological system? Look at the shape. Huh? Loud.
It will bind to a rectangular
some biological system. Yeah. Okay? So basically, the drug is nothing but a small molecule. I said the already word small molecule. I don't know why it has to be small molecule. We'll come to that. Which can go and block a biological function of an unwanted biological function without disturbing the wanted biological function. Correct? And biology takes place very fundamental principles of chemistry. So any object you take, any chemical entity you take, they are all three-dimensional objects. So they have a three-dimensional shape and a three-dimensional charge. They have charge and shape. So if you have an object with a particular charge and a particular shape, it can interact with another object whose shape is complementary and the charge is complementary. Agree? All of you agree? Completely? This much you agree, no? So the chemistry is nothing but interaction of molecules with complementary charge and shape, leading to a new product or no new product, just binding. When a new product takes place, we say chemical reaction has happened. When no new product takes place, we say chemical binding has happened. A binding has happened, but binding is reversible. Now tell me, what type of molecule you want as a drug? Let's say I have to close this door and I want to make sure the door doesn't get closed. So I put a wooden piece here. Correct? Huge door. It will prevent, no? So basically, I have to look for something that goes in and blocks. But it should not go and block everywhere. Now, I'm sure many of you have been told there is some rules, no? Pharmacopoeia, right? A size has to be, what size? 500. Can anybody tell me less than 500? Okay. 500 at molecular weight. We'll have how many atoms? Garbar. Okay. What are the atoms you think the drug will be made out of? Look at this. Carbon, nitrogen, oxygen, sulfur, phosphorus. Most of the same, right? Hydrogen will be there. There's no problem. Oxygen is there, right? Average molecular weight, atomic weight, is about 12 to 20 something, right? Phosphate is little more, phosphorus. So therefore, about 25 atoms. Forgetting hydrogen. So you can count maximum 12 to 25 atoms. Anywhere between 10 to 25 atoms will be most of your drugs. Why? Why can't we be big?